hydration is probably one of the easiest things that you can do to correct and reduce inflammation. But hydration isn't as simple as just drinking water throughout the day. Like your body, based on your composition, height, weight, muscle mass, fat, and mine, require a different minimum amount of fluid.
Welcome back to another episode of the Peak Performance Life podcast. Today, I am super excited. Before we get into our special guest, I just want to remind you, if you are a repeat customer, we don't do external ads, but we do ask if you could please share, subscribe, like, rate, review. We really appreciate that. That helps us grow here and spread the message. So today we have a very special guest. He's Dr. Ryan Greene. He's an osteopathic physician specializing in human performance, sports medicine, nutrition, and the most cutting-edge recovery methods available. He is a managing partner and principal medical advisor at Monarch Athletic Club in West Hollywood, which is the first private sustainable health and wellness facility delivering traditional training services combined with physician-directed, evidence-based integrative medical interventions. So he is working with a lot of people out there, celebrities and all sorts of people out in Hollywood. And he's going to be sharing some incredible wisdom with us today about lowering inflammation in the body, increasing your performance, both mentally and physically, as well as many other topics. So Dr. Greene, thank you for joining us today.
Thank you for having me. It's an honor to be here. Sorry, that was a mouthful.
Yeah, no,
I got to shorten that summary.
You had about, I know you had about 3 pages of accolades and achievements, so I had to kind of shorten it there. But yeah, we're really happy to have you on. And I guess why don't we start by, if you want to give sort of a brief, short background and kind of what you're up to these days with Monarch.
Yeah, sure. So 10,000 foot view description, so to speak. When I was in training, just incredible places. I was at Dartmouth for residency and Mayo Clinic for a fellowship, and I saw the incredible work that was being done. But I also saw a gap in the fact that most people like myself at that time, who was generally healthy, loved training, eating well, just living a high quality, high energy life. Wasn't seeing many of those people, because most of us do whatever we can do to avoid having to go into a hospital system. And it's just unfortunate, right? Because there's a lot of intelligent people who want to help, but just based on how our system is designed in the US, it's difficult to find people that can answer questions, takes a lot of time, costs a lot of money. So something just didn't quite sit right. And so had the idea for what is now Monarch Athletic Club, and was fortunate. Fate intervened and connected me with some people that had the funding and also helped with executing the vision. And we created what is in the simplest terms, a one-stop shop. So our approach is essentially the foundational elements of health are what's going on in your body from a medical perspective, metabolic perspective. What do you put into it, which is nutrition? How do you move it, strength and conditioning, and then how do you keep it in good working order, which is where our physical therapy team comes in. And so our approach is, if you can do and be proficient at those basic elements, you should live a long and healthy life. And then if you want to get more complicated, if you want to get more intricate, if you want to layer in some of the new technologies, that's great. But if you don't have the foundation in place, does it really matter? Maybe not, probably not. Mm-hmm. But most people these days, if you are wellness savvy, you have to go to one place to train. You have to try to find a physician that thinks like you do in terms of body work, physical therapy, whatever. You're going to other places, they're not going to communicate, or very rarely will they communicate. So you end up being someone who's trying to digest all this information and put together a program for yourself. So we've essentially reverse engineered that and said, everything you need is here, other than imaging and the capacity to do surgery. And as long as you show up and you listen and you're consistent and you're somewhat compliant, you will do well. Health metrics will improve. Chronic disease risk will go down. Energy, quality of life, all those things will get better. And so like what we've kind of digested our, philosophy or principle method of sharing what we do is, what we want for people is to be able to be healthy, to feel good, so that they can do what they want to do for as long as they want to do it. Because if you're not healthy and you don't feel good, you don't really care about anything else. And that's going to detract from, the maximum happiness and amount of joy that you can extract from your life. So what we did is we created a higher end facility that feels like a nice fitness facility, wellness club, but layered in the medicine, the movement, the physical therapy, the nutrition. And as long as you're compliant, you'll do great. And if you are not, you won't. But that's the same no matter where you go. We've just brought it all together, made the price, very affordable for everything that you're getting. And because we're a medical facility, we have the ability for certain services to leverage insurance benefits, which allows us to really expand our scope in terms of who we can work with, from not only the weekend warrior type, but anyone who may be thinking about surgery, going into surgery, just coming out of surgery, because we have a multidisciplinary, talented team that can basically handle anyone at any point of their health journey. But it just doesn't feel like a sterile medical office or a rehab facility. It feels like your higher end, wellness type club. So we really wanted to avoid kind of the fee for service model, where if you want to get more information, you pay more. We basically just say, here's what we offer, here's what you get. It's a relatively low price. It's like an all you can eat buffet. If you really want to get a lot, you'll spend a lot of time here. And if you don't, you won't. So that's what we created. And we're about to open our second, it's just crazy to me, especially in the pandemic period. We're super grateful and super fortunate that the model resonates. Because the other nice thing is it's a relatively small community by design. Each facility is going to have roughly 200 members, because one, you get to know people, you develop relationships, and that community component is that intangible. Like, why do you do anything? Why do you go to the same barbershop, same restaurants? It's because you're comfortable and you feel safe and you feel supported. And the same thing with movement and health, which can be a scary topic. You want to be in a place that you feel, comfortable, and that you're not going to, we're removing like that fear associated with asking questions about your health. We want to become allies for you. And one of the best ways to do that is keep a relatively small population. But as we open more and more facilities, your program, the way we design it, is transferable no matter where you go, which helps us achieve that compliance aspect, which is problematic for a lot of people, because if you're tied to one location, one trainer, one class, whatever, when you travel for business, work, pleasure, now what do? You have to find a place to go. We want to try to eliminate that so we can, have as many facilities as possible, and then create an added value component, which is, you always have a home no matter where you're at in terms of wellness. So that's Monarch. It's been about 5 years into development. Our first location's been open just over 2 years. We opened right in the teeth of a pandemic. And, fortunately, because we're a medical facility first, we were deemed essential, which I would argue any fitness or wellness place is essential, but we've learned how that can be problematic over the last few years. But it's been a great opportunity for us to kind of cut our teeth and figure out what works, what doesn't, where we need to improve. And now we're about to open a second, and then a third shortly after that. So it's been pretty exciting, pretty busy couple of years, but I wouldn't trade it for the world.
Nice. Yeah. Great stuff. Congrats on everything there. And I really like that holistic approach. And, kind of speaking of which, the listeners, many of the listeners know my story. Back in 2013, I had massive pain and inflammation in my arms, just eating really unhealthy, bad posture, banging away on a keyboard 12 hours a day, with a laptop on my lap, bad posture, eating horribly. And I actually had to use a voice dictation software for 2 years because it hurt too. I was in so much pain just typing. And kind of eventually I realized that, at first I was looking for all the quick fixes, a compression sleeve, a wrist brace, a pain relief cream or something. And eventually I realized, okay, wait a minute, and I also realized, because one day I thought it was carpal tunnel, then it's cubital tunnel, then it's arthritis, it's tennis elbow, it's golfer's elbow. I don't know. Every night I'm reading and on the internet, and I'm thinking it's something else, right? So I'm kind of confused. I'm frustrated. Eventually, what I kind of came to the realization is that inflammation, comes from inside of you, mostly a lot of times what you're putting in your body, obviously how you're treating and moving and, all the other things you guys do as well. But is that something you see a lot, that like, talk about inflammation, like with your clients, what you're seeing, how you guys are advising around that and working through that?
So yeah, it's, inflammation is it's a difficult one just because it's somewhat broad, somewhat vague.
Mm,
I somewhat joke with our members in our patient population, like inflammation, we've kind of made an adjective, like I have inflammation, but like they're actual proteins, right? They're signaling molecules to indicate something isn't within, good balance or homeostasis in the body, and in our immune system, or, other systems need to address what's happening, right? It's a warning signal. So we kind of redefine inflammation for people in terms of the understanding of, like, we need it. We don't want to eliminate it, which is what a lot of people do in terms of they're on ibuprofen,
mm.
other NSAIDs a lot, because they're just trying to minimize their inflammation. But it's a warning signal. It's something that we need to be paying attention to, and also appreciate that a little is okay, a lot for a long period of time is not. It's deleterious in terms of health. And the best example that I can think of are diabetics that have, it's a metabolic disease. It's associated with inflammation. You start to experience poor peripheral vascular flow because the inflammation proteins cause, calcification, hardening of especially small vessels, and also nerve damage, right? And then there's the risk that you cut your foot, you get an infection, and that's kind of the traditional life course of a diabetic, which is infection secondary to the issues with inflammation. And we see a lot of people in our patient population that come in with inappropriate inflammation levels, which you can measure in the blood, as well as indications of metabolic disease, whether it's present or developing, based on some other markers that you can check, such as hemoglobin A1C, which is kind of your metabolic disease, diabetes risk factor in brief. So part of what we do with everyone is initial intake. The first thing they do is they meet with us. We're doing blood work, body composition, nutritional analysis, lifestyle modification, because I think the easiest area to address for inflammation is in your diet. What you put in is what you get out. If it's garbage in, you get garbage out. If it's half and half, you get half and half, right? The other thing that people don't understand is your gut is so vital in terms of everything that you do, primarily because the majority of your immune system is in your gut. And why wouldn't it be? Because it's your first line of defense against a foreign pathogen or invader from getting in from the outside space through your gut tube into your body. So again, if you're putting in stuff that's non-nutritious, low in fiber, high in simple sugars, like, it's causing havoc in our gut, which wreaks havoc for our immune system. And then we have a lot of these kind of like nondescript issues that people show up with. It's not like, for you, bilateral arm pain. For other people, it may be brain fog. For some people, it may be low mood, like whatever it is. But you can usually trace it back to some sort of excess inflammation, and often it's associated with nutrition or diet. The other thing that I'm acknowledging is an area of growth for us, which we're working on, is the mental health space. And without dovetailing off there, like, the majority of our neurotransmitters are coming from our gut, right? So there's a reason why we say, like, when you're trying to make a difficult decision, trust your gut. Somewhat of like just a traditional idiom or phrase, but there's also an association with, the serotonin, other neurotransmitters that are coming from our gut. And if you don't feed your gut well, your brain can't do what it needs to do, and vice versa, right? So I think the first thing we focus on in terms of inflammation is, what are you putting into your body? And that's not only food, but also, water. I think I know a lot of people are, poorly hydrated. About 80% of the world's population, by reasonable recent metrics, live in a fluid depleted state. So you can drink some water there. Perfect. And
You triggered me to drink some water for sure.
yeah, exactly. And that's another trigger for unnecessary inflammation, because if you're volume depleted, if you're not adequately hydrated, again, your body doesn't you're not dying of thirst, but it recognizes, hey, blood pressure probably not going to be adequate. Perfusion to organ systems not going to be adequate. How does it maintain it? cortisol levels have to go up to help, improve vasoconstriction, to increase blood pressure. Cortisol as a byproduct is going to elevate blood sugar. It's going to potentially increase inflammation. So literally just not drinking enough water could also contribute to this unnecessary, easily manageable source of inflammation. So a lot of the work we do is not high tech. It's not, invasive by any means. It's literally just saying, like, we know large volumes of inflammation for a long period of time are detrimental to your health, quality of life, everything. What are the things that we can do to address that, even before you step onto the floor, even before you go work with our physical therapy team? And if you're not eating well, if you're not eating appropriate, quality, quantity, frequency for your lifestyle, that's an issue. We need to address it. If you're not drinking enough water, that's easily correctable. Most people have no idea how much they drink or how much is appropriate. You don't have to spend more than 20 minutes with me to get two, pretty valuable pieces of information in terms of, appropriate nutritional intake and hydration. So that's one area that we really focus on. And the other big part is understanding sleep. So sleep's another big one that we focus on, especially on initial intake, because there is, no amount of movement, nutrition, supplementation that is going to overcome inadequate sleep. And I think we really undervalue that, myself included. Like, I have a startup, I have all these things going on. I probably get 6 hours of sleep a night. Like, by the end of the week, I recognize, man, like, things don't always feel as good as they could. And, I have access to everything that we can do to help mitigate the impact of the inflammation associated with that alone. But those are some areas that we really focus on, because I think if you can get people hydrating, eating, and sleeping appropriately, the rest is pretty easy, as long as you can just, show up and do the fun stuff, which is the exercise and things like that. So we really place a lot of emphasis on those components, because at the end of the day, like, our patients and our members are successful not just because they work out, but because they learn the things that they need to do, whether they're here or not, that will allow them to minimize the amount of unnecessary inflammation that's introduced into their system, and will ultimately allow them to live a higher quality, longer, more enjoyable life, if that makes sense.
Yeah. I really like that. And I think, a lot of times there's a lot of people kind of talk past each other when it comes to health, in terms of, like, someone's like, oh, it's just calories in versus calories out and working out. And then, like, well, it's like, okay, yes, that's body composition, right? But if we're talking about longevity, there's more to it than that, right? Actually, I was curious real quick, is there a way to measure hydration, and if someone's well hydrated, or is it more just based on symptoms of the person?
So there's a couple different things that are available. So, like, for instance, we use the in-body, bioelectric impedance analysis machine. It's okay for macro changes, micro changes, not super valuable. I would love to have a DEXA, but in this space, it just literally physical space wouldn't allow for it. We'll have it in future locations. That can measure hydration status. Some have the ability to do intracellular versus extracellular water, which may be valuable if you believe in the efficacy of the testing modality. Like Gatorade and some other companies have, like, sweat patches now, so you can start to figure out, like, what is the electrolyte composition of your sweat, so you can figure out how to more accurately rehydrate if you're really dialing in not only on fluid volume but also electrolyte composition, because some people lose more sodium versus potassium, or vice versa.
That's real interesting.
Yeah.
I was going to ask you about that too, about electrolytes, because you
Sure.
spoke about hydration, and kind of electrolytes are kind of the new craze when it comes to hydration and everything. And I'm curious your thoughts about it. And
Yeah.
And it's interesting how you said that would be interesting for me to see, like, okay, a patch that tells me, because some electrolyte powders are giving me, whatever, just some random amount of each of these, sodium, potassium, magnesium.
Sure.
Which
Yeah.
one do I need or not need? Do I even know? Right. Like,
Exactly. That's the point. It's like, we're kind of seeing the field of wellness, like, take these incremental steps forward, and it seems like massive technology, but it's not really, in the sense of, like, starting from the simplest intervention, like look at your urine, right? Like that's the best way to tell if you're hydrated or you're not. Outside of if you're drinking caffeine, because that can, or alcohol, that can kind of be a little bit misleading in terms of your hydration status. But first things first, look at your urine. Second thing,
So real
that,
quick on that, just to kind of dig into that a little bit, because I'm curious, I'm sure some
Sure.
listeners will be too. So, all right, let's say most people drink a coffee in the morning. So let's say we're waiting. So let's say in the afternoon, is it kind of the old adage of you're looking for it to be clear, you're not looking for it to be dark? What is it? How could you really tell?
So I'm gonna take us back a little bit, because the coffee in the morning is something that I actually address with a lot of our members and patients. So, again, like the data in terms of its specificities is a little bit difficult to collect, but the majority of performance specialists would indicate, and probably yourself, when you wake up in the morning, you're dehydrated, right? Because you're not peeing overnight, you're not drinking water overnight, and with every breath that you take, you lose a little bit of moisture. If you look at your urine, male or female, doesn't matter. Your first void in the morning is probably darker, right? Because your body's been excreting fluid with your breath, and then also been utilizing, right, to keep you alive. Where I try to direct people in terms of, the hydration component, especially of inflammation, is if the first thing that you do is drink a caffeinated beverage, coffee, tea, pre-workout, right? Caffeine's a diuretic. It is going to stimulate you to urinate. If you look at your urine, it's probably going to be a little bit clear because your body's excreting water to shuttle out the caffeine. But if you haven't drank water first thing in the morning, which you should do, you are now diving deeper into this rehydration hole that it is difficult to get back up. And then if you think about it, like, you climb back up, but if you don't get to where you want, then you go deeper the next day, and then you dive a little deeper because you do coffee. And so you end up like, far below where you should be in terms of adequate fluid volume. So that's part A. Like, people need to start rehydrating first thing they do when they get up.
Glass of water,
to your point,
at least a glass of water before your coffee.
Before your coffee. The
Yeah.
other part is the electrolyte discussion, which you're spot on with. So the way your kidneys work, in brief, they're measuring what's called osmolarity, basically the fluid to non-fluid component of what's in your blood. So if you are dehydrated, right, non-fluid component has a higher prevalence than the fluid, so your body secretes ADH, you hold on to fluid to balance things out. Conversely, if you drink too much pure filtered water that has no minerals, no electrolytes, anything like that, the fluid balance shifts. So now you're a little bit dilute, and your kidney's gonna be like, this is great, but we don't need all this water, we get rid of it. So the whole point, and I share with people, is if you're gonna be drinking fluid, pure filtered water, probably not the best thing in terms of rehydration. You should think about something that has some sort of mineral or electrolyte composition. I love mineral water. You can get it very cheap. But if you cannot,
do you mean like spring water, mountain water?
Yeah, I do like Mountain Valley, Perrier, Pellegrino. But if you can't get that for whatever reason, filtered water with sprinkle of sea salt, apple cider vinegar, a squeeze of lemon, lime, citrus, electrolyte powder is somewhat general, but like, you have a higher probability of more effective hydration if you go that route than just doing pure filtered water. And I think that's where some people assume, well, water is all the same. That's not true. I mean, that's where Gatorade made their money, which was figuring out water is not all the same. We need something that's specifically designed for people that are sweating a lot and athletes. So to answer your question kind of in a circuitous way, hydration is probably one of the easiest things that you can do to correct and reduce inflammation. But hydration isn't as simple as just drinking water throughout the day. Like, your body, based on your composition, height, weight, muscle mass, fat, and mine, require a different minimum amount of fluid. And there's an equation, that is you can utilize to try to figure out your minimum fluid intake per day. And part of what we do here is kind of monitor people's fluid intake. And now there's even water bottles, like Hydrate Spark is a pretty cool concept. That's a Bluetooth enabled hydro flask, essentially that can literally measure to the milliliter how much water's in the vessel. And if you program, like, this is my height, weight, body composition, it'll tell you, it'll literally light up and say, hey, it's time for you to drink water, you're falling behind. And you can track your fluid intake throughout the day. So it's pretty cool, like the stuff that's coming out. I think for the most part, people just need to understand like how much fluid is appropriate for me. There's a way to figure that out, and then building that practice into their daily life, because I think that alone, which I've seen with many of our patients here, immediately, they're like, man, I have more energy, don't need as much caffeine, sleeping better, recovering better, that inflammation that, I've been feeling aches and pains starting to resolve. And it's because you're giving your body its most critical, substrate for energy production, healing, cellular efficiency. And if you don't have it, you're going to be, your outcome's going to be attenuated. It's just going to be not as effective.
Yep. Yep. And so you mentioned also that one of the first things you do, kind of on intake is you do blood work on
Yes.
clients, right? Which I think is a big. I'd like to say that it's the future. I mean, it really should be the present. I mean, it's really something almost that everyone should be doing, but not many people are. I just got mine drawn a couple of days ago. I'm like excited to see the results. I'm like, oh, let's see if I, improve the different levels I've been working on, for the past 6 months or whatever. What are some of the markers that you think are most important that you kind of are really looking at the most, or just to kind of touch on for listeners?
Yeah. So simple markers of inflammation. So CRP is a big one. That's a little bit, more of the acute phase. It's not necessarily specific depending on what test you get done in terms of where it's coming from, but it can tell us, within, the present last few days, how much inflammation has been present in your system, right? But it fluctuates. It's volatile. Hemoglobin A1C is a big one, because that's essentially the metric associated with metabolic disease, diabetes risk. Can help us indicate like, how's your diet been, because it's, somewhat of a proxy of blood sugar control, insulin sensitivity for the last 2 to 3 months. Hormones are a big one for us. Like, it's not an expensive test, and we're seeing, no shortage of direct consumer hormone testing that people can start doing. And even the next step, which is like, telemedicine prescriptions coming through for insulin sensitivity, hormone related issues. I'm seeing a lot of people, around my age, I'm 35 and younger, with suboptimal hormone production. Partially it's lifestyle, partially diet. And it's just one of those things where, like, most practitioners, to no fault of their own, are just like, oh, you're in range, you're okay. Well, like, we know what optimal should be. And, it's not often in the middle of the reference range. It's usually towards the upper end, but we're just not used to even thinking about younger individuals requiring hormone supplementation. But a lot of people are doing it. And as long as you do it with, reasonable oversight from a medical professional, it can be very effective. Thyroid's another big one that I think we've kind of missed the mark on, and are circling back in terms of the impact of these endocrine disrupting compounds that you can find in plastics, preservatives, synthetic ingredients, chemicals, that are in our foods, and like even like hand sanitizer, right? Like triclosan, we've acknowledged, anything we rub on our skin gets in our bloodstream for the most part. What's it going to do with repeated exposure over multiple months to years? Now we're finding out. And one of the things that's impacted is thyroid function. And thyroid is one of the primary drivers of our metabolism. And metabolism is more than just weight. That's a huge part of it, but it's temperature sensitivity, it's energy, it's mood, hair, skin, nails, anything that has a high metabolic rate. Thyroid is a critical component in the direction of those types of processes. And so we're seeing, men and women who are struggling with losing body weight. And when you look at their thyroid function, again, quote unquote, within range, but definitely suboptimal for people in their 30s, 40s, 50s. You're seeing metrics associated with people in their 60s, 70s, and 80s. And really, like, the only reason I can surmise is it's our quality of life, what we're exposed to, what we're consuming, in and on our body. So that's a big one that I've found unique. It's out of range. And then sex hormone binding globulin is another big one. I don't know if you're familiar with that, but again, easy to test, not expensive. In brief, like, sex hormone binding globulin's purpose is kind of like a transport protein to bind testosterone, shuttle it around our system until the physiologic request comes in that we need it, then it'll break away, get broken down, repurposed. But we are seeing more and more people with elevated levels of sex hormone binding globulin for a multitude of reasons. A lot of it's obesity, some alcohol related. A lot of people, at least in our cohort, overtraining, under eating. So they're basically, training too hard. And if you think about it, it makes sense. Like if you're burning a ton and not giving yourself a lot, yeah, your body's going to want to slow you down. It's like, hey man, like you're doing too much. And so if you bind up all this testosterone because you're producing more sex hormone binding globulin, then your get up and go, your vitality, that energy source, not as easily accessible. So hopefully you'll slow down. A lot of people don't. And then they're like, why am I not recovering? Why am I losing muscle mass? So the other one that's been interesting is synthetic estrogen exposure. I think we're learning more about, and I say that in terms of birth control, right? So a lot of women been on birth control for a long time. I'm seeing many, many female patients who have kind of low energy, difficulty losing body weight, things associated with lower, testosterone levels, and their test levels are okay, but their sex hormone binding globulin levels are like through the roof. And you're just like, all right, let's, tackle the simple things. Are you eating enough? Are you training too hard? Are you getting enough sleep? Are you drinking too much alcohol? Are you obese and we just need to work on body weight? Most of them are not. And the one thing that we're, starting to work on right now is like, it may be time to make a decision on, is this synthetic, birth control appropriate for you, right? I understand why people do it, skin related issues, family planning issues. But if it's driving down, your ability to adequately utilize, these hormones that are vital for you, is it worth doing? And so that's an interesting one because it's relatively new in terms of our clinical understanding. So those are some big things that we look for on top of your just basic CBC, which is immune system, hemoglobin, your metabolic panels that are looking kidney and liver. Cardiovascular disease panel is pretty interesting in terms of looking just beyond cholesterol. Some lipoproteins, apolipoprotein B is one that's associated with increased cardiovascular disease risk, like beyond just the traditional cholesterol metrics. And lipoprotein A is a genetic metric that there's nothing that you can do about, but some people are testing that just to understand like what's your genetic risk for cardiovascular disease. So again, things that are more commonly available, you don't need to, you have like specific special labs to do these. Most traditional labs can execute them. And, again, relatively low cost. So we try to do our lab work every 3 to 6 months, just depending on the individual, because it's like, checking fluids in your car. Like if you're not looking, why would you expect your car to be, functioning well? Your blood can't lie. What's there is there. So you might as well check under the hood. So those are things that are pretty consistent in all of our panels, because I think we can get a lot of information from them with regards to your, physiologic health, inflammation risk, things like that. And we don't do a lot of like the specialized testing because, as I alluded to earlier, like food sensitivity, heavy metal testing, things like that. I understand why people would want to do them, a lot of stool testing. At the end of the day, where I kind of direct our team to go is like, those have value in certain situations, but until you can show me you can stick with a movement program, hydration, eating, sleep program, and correct some of these common metabolic abnormalities if present, like I don't really see the need for diving in and getting a little bit more, complicated in terms of your health investigation. Because if you can't do the simple stuff, like what's the point?
Right.
That's how I approach it. So
if you're overweight, have pre-diabetes, you're not exercising, then heavy metals, yes, it could be a concern, but probably way low down on the list. Yeah.
Right. It's like it's even if it is contributing to some sort of health outcome, my suspicion is the bigger issues are correcting those other things first. So that's kind of how we approach it. And for the most part, like we've been doing really well with most people that don't do well in our system, just they don't show up. And for everything that we try to do to incentivize them to do otherwise, unfortunately, some people they say they want help, but then when push comes to shove, like it's I've come to terms with like one of the things that we have to do is find a way to incentivize or gamify kind of health, because if exercise was going to fix the problem, we would have, we've had exercise forever. Like, we've had gyms forever. For whatever reason, like, just feeling good and looking good is like, it's not enough of a motivation for a large number of people. So that's why we're kind of doing what we're doing in terms of trying to use the system as it's currently constructed to get some sort of insurance or financial incentive. And we have a couple incentive programs that we've employed here that literally say, like, if you execute, a program and you show up a certain amount of times, you decrease your metabolic risk, your inflammation risk factors, like, we'll give you money, like, we'll give it back to you, because, like, why not? You're healthy, you're happy, and for us, it's just wonderful to keep you a part of the community. And like, who doesn't want to get money back or something like that? So it's been pretty interesting, because you can show people that they're pre-diabetic or diabetic, and like, you'd be amazed how many people do not change their behavior, and you're just like, why?
Right.
Like, I don't get it. And so yeah, it's
That's-
sometimes, even though you show someone that they're driving off a cliff, they're just like, it is what it is.
Yeah, it's unfortunate. Sometimes people don't do it until it's too late, but hopefully, hopefully, people listen and learn here.
And for you
Yeah.
specifically, right? Like, you could have absolutely gone down the road of like, all right, it's going to be antidepressants, it's going to be gabapentin, it's going to be maybe even opiates, because like, that's easy, right? And it doesn't really take that much effort.
Surgery, I could have gotten carpal tunnel surgery. I could have gotten, then it's like, oh no, you had a herniated disc. So I could have gotten back surgery. I could have done all these things. But I wanted to first, I said, okay, before I go and do a surgery, let me make sure I've exhausted, right?
Yeah.
Sometimes surgery may be needed, but let me make sure I've
Sure.
exhausted everything from a holistic, natural standpoint, like what you guys are talking about,
Yeah.
before I do that. A
Sure.
couple of markers I did want to ask you about as well.
Sure.
So number one is cholesterol, and then I'd like to ask you about testosterone. There's a lot of talk about
Sure.
TRT and that kind of
Yeah.
stuff. I'm a lot of people I know are considering it. But first, let me ask you real quick about cholesterol, because that's another one where it's like, as I went on personally, I feel way better on lower carb. I still eat some carbs, but like lower carb and some higher fat. And so as I started consuming more MCT oils and some more higher fat diet, my cholesterol went up. But my HDL, my good cholesterol was high, but LDL was a little bit higher than it should be as well. And then what's your opinion on that? If people are eating kind of a low carb, high fat diet and they're exercising and their, HDL is good, or just overall, is cholesterol, there's been a lot of talk about maybe it's not as just so cut and dry of like cholesterol causes heart disease. Maybe there are other factors. I'm curious what your opinion is
Right.
as an MD.
Yeah, I think I would follow into like that second bucket, which is there is a point of diminishing return. Like, if your cholesterol levels get too high,
Mhm.
I think there is potential risk in terms of clotting, potential like vessel blockage. It's like traffic. There's just too many cars on the road, right? That being said, cholesterol is a building block of every cell in the body, part of the cell wall. Your brain, about 7 to 8 pounds of fat comes from dietary and otherwise. I think the biggest issue is elevated cholesterol in an environment, in an ecosystem of elevated inflammation. So most people that have high cholesterol traditionally are not those like you who are eating high volumes of healthier fats and proteins. They're eating trans fats,
Right.
simple carbs, right? So not only do they have elevated cholesterol, but they probably have elevated CRP. Lipoprotein B4 is elevated. Probably A1C is also elevated. Again, a more chronic metabolic disease risk factor. And we know biochemically it's the LDL specifically, the smaller dense LDL particles that have a higher likelihood of binding with some of these inflammation proteins, essentially becoming inactive and then precipitating out of the bloodstream, embedding themselves into the walls of vessels, which again creates more inflammation, which creates a larger cascade of these plaques essentially building up. I think that's the biggest issue. So, looking at your cholesterol metrics, I tend to take a look at our patients and look at it through a prism of like, what are you doing from a health perspective? What are your markers of inflammation? Where are these fats coming from? What are the sources of cholesterol? And, and again, like also genetics, right? Like if you have a family history of heart disease, heart attack, that's something to consider regardless of your health history. But if you come from a generally healthy family where people are living in their 80s or 90s, and you happen to be from Scandinavia, where people are genetically designed to tolerate, higher volumes of fats because that's historically what they've been able to consume based on where they're from, like I would be a little less aggressive in terms of just trying to get those cholesterol numbers down. So I think to your point, it's a little bit more complicated than just numbers. I think you need to do a little bit more investigation and understand who your patient is, what do they do, and what does the rest of their metabolic ecosystem look like. So I think I would fall on the second side of that.
Got it. Yep. Yeah, that makes a lot of sense. Combined with the inflammation markers, especially, that makes a lot of sense. So what about TRT? I wonder kind of what your thoughts are. I imagine, you have clients that come in with very low testosterone. And then I also wanted to ask you a little bit about, because someone recently mentioned to me, well, free testosterone is the one that matters more or something like that too. And so
Yeah,
I'm curious your thoughts about the free testosterone, regular testosterone, TRT. Do you think it's beneficial? Can people start TRT too young? Like if you're still 30 in your 30s, is it too young to start? Because then
sure.
you're pretty much going to do it your whole life, I guess, or at that point, right?
It depends. So TRT is kind of like the umbrella descriptor of a hormone replacement, right?
Right.
So the way we look at it, the way I like to look at it is, okay, how old are you? Again, look at those other metrics. What's your diet like? What's your exercise level, sleep, alcohol intake? Because all those things are important in terms of appropriate hormone output. Should you have suboptimal testosterone levels based on your age, and it's different at different ages, that's something to consider. Your free testosterone level, again, also something to consider because that's the active, like usable form. What's your sex hormone binding globulin level? That's something to consider in terms of like, is that something where your free test is low because your body's not able to access the testosterone it's making, and you may have ample testosterone, right? Like I've seen guys with test levels of 700 who have super high sex hormone binding globulin metrics because they're overtraining, under eating, and their free test is low. You just get them to eat a little bit more, appropriate for their lifestyle. You see SHBG go down, you see their free test go up. Also understanding like the biochemistry of hormone production, like for testosterone specifically, you have cholesterol, then you have pregnenolone, then you have DHEA, then you have andro, then you have test. So like, is your test low because your DHEA is low? Is it low because your pregnenolone and or DHEA are low? So like there's more things to think about. To your point, in terms of supplementation, there's a lot of things you can do. You can do pregnenolone, you can do DHEA, you can do Clomid, which is off-label use. It's a female fertility medication that men have been using for a long time, and commercially available with some at-home hormone testing kits now, where you can get prescriptions sent nationwide. Basically, what it does, it stimulates the Leydig cells, so that the functional unit of your testes, to produce more testosterone. So conversely, compared to a testosterone shot, which is exogenous, oil-based test, cypionate, ethionate, whatever you get. If you inject it, your body senses, hey, our test levels are going up, which is great, but you're going to slow down your natural production or stop it. So to your point, like, okay, well, if you're going to take test shots, what's your end game? Are you going to do it forever? Are you going to do it for a couple months? What are you going to do to reinvigorate your own testosterone production? Is it going to be Clomid, which stimulates your testes? Is it going to be HCG, which is now basically impossible to get? That again stimulates your testes to produce more testosterone.
Pregnenolone, I've been hearing a lot about pregnenolone. In fact, I just bought some for my father, who's in his 80s now and starting to have a little issues with fatigue and dementia and things of that nature. And someone recommended it, and I keep hearing about it. Could pregnenolone or DHEA on their own actually raise your testosterone levels? I've heard of people taking them in conjunction with testosterone as well.
Yeah. So like theoretically, there's a couple chemical conversions that are required to get from those things to testosterone. So like hypothetically, if you take it, it should help support. In practice, do you see that a lot? Sometimes, sometimes not. So yeah, absolutely. Like if I would be remiss if I told a patient that they need some sort of hormone replacement therapy without looking at all the available things we could measure that contribute to its production and not correcting underlying issues. So I think that's something that practitioners should keep in mind, as well as people looking to potentially do hormone therapy, because again, like if you could give yourself testosterone and feel great, but what's the end game? If you're your age or my age, fertility is impacted, right? And like for how long? Like if you want to have kids, you want to have a family. If you start TRT at 30, you don't have kids yet, like they're investigating testosterone cypionate as a potential male birth control, right? Because it's like, we know it decreases sperm count, it decreases fertility. Perhaps we put people on low doses of test and they can do that as a, the male version of oral contraceptive. So like, there's a lot of things that you have to think about before you start. That being said, Clomid is one of the more effective, lower risk, higher benefits, because it's stimulating your own natural production. And it is off-label used. Like when people look it up, they're like, am I taking a female fertility drug? But technically that's its FDA approved designation, but people have been using it off-label for a long time.
I haven't heard of that one very much. Clomid. So is that's you need a prescription, and is it just a pill you take orally?
Yeah, some people do it every other day. I have people do it typically every 3 days, just based on a protocol that I've been using that I was educated on by a physician named Dr. Mark Gordon, who does a lot of work in the military TBI, PTSD space, and does a ton with neuroinflammation and especially hormone optimization associated with mood states. So that's an interesting one. There's some peptides that are coming out that are relatively newer they're called gonadotropin releasing hormones. So they function similar, like as the name indicates, gonadotropin. So it's like gonads, testes. They're basically like the naturally stimulating our brain to produce these hormones that tell our testes then to start increasing, production of our sex-based hormones. So there's a lot of pretty interesting things that are coming around. I just would really strongly encourage anyone who's thinking about hormone-related therapy to look at the underlying causes of why their hormones may be suppressed or less than optimally produced. Is it lack of sleep, too much stress, drinking too much alcohol, poisonous to your testes? Are you not resistance training, right? Like, what are the things that are driving it down? Because even if you do some sort of supplementation, if the underlying entities are not corrected, you're going to go up and then come down. You're going to go up and come down. And like, if you're going to start in your 30s or 40s, like, do you really want to be doing this for the next 40 years? Maybe, maybe not.
Right.
So,
right. Well, Dr. Ryan, this has been amazing, man. This has been really great information. I've learned a ton. So yeah, I'm happy for myself, happy for everyone listening that we got to learn some great knowledge here. If people want to continue learning from you, what's the best place for them to follow you, learn more from you?
Yeah. So my Instagram is at Dr._Greene with an E at the end, _DO, Dr. Greene DO. Monarch is at Monarch Clubs on Instagram, and then monarchclubs.com, Monarch like the butterfly. So feel free to reach out. I'm really good about getting back to people, and happy to, have conversations when I'm able, because ultimately, the more evidence and information we can get out, the better. So I thank you for having me and championing this health and wellness movement. So thank you very much.
Yeah, thank you, man. This has been great, and look forward to speaking with you again soon.
Sounds good, buddy.
Thanks for listening. And just a reminder, if you haven't yet tried any of our Peak Performance products, you get 20% off your first order. We have one of the largest selection of USDA certified organic superfood powders, as well as very high quality supplements. And you get 20% off your first order at buypeakperformance.com. That's www.buypeakperformance.com.